Tick-borne disease. Tick-borne diseases, which afflict humans and other animals, are caused by infectious agents transmitted by tick bites. Tick-borne illnesses are caused by infection with a variety of pathogens, including rickettsia and other types of bacteria, viruses, and protozoa. Because individual ticks can harbor more than one disease-causing agent, patients can be infected with more than one pathogen at the same time, compounding the difficulty in diagnosis and treatment. As of 2016, 16 tick-borne diseases of humans are known, 4 discovered since 2013. As the incidence of tick-borne illnesses increases and the geographic areas in which they are found expand, health workers increasingly must be able to distinguish the diverse, and often overlapping, clinical presentations of these diseases. Exposure. Ticks tend to be more active during warmer months, though this varies by geographic region and climate. Areas with woods, bushes, high grass, or leaf litter are likely to have more ticks. Those bitten commonly experience symptoms such as body aches, fever, fatigue, joint pain, or rashes. People can limit their exposure to tick bites by wearing light-colored clothing, including pants and long sleeves, using insect repellent with 20%-30% DEET, tucking their pants legs into their socks, checking for ticks frequently, and washing and drying their clothing in a hot dryer, assessing risk. For a person or companion animal to acquire a tick-borne disease requires that that individual gets bitten by a tick and that tick feeds for a sufficient period of time. The feeding time required to transmit pathogens differs for different ticks and different pathogens. Transmission of the bacterium that causes Lyme disease is well understood to require a substantial feeding period. For an individual to acquire infection, the feeding tick must also be infected. Not all ticks are infected. In most places in the U.S., 30 to 50% of deer ticks will be infected with Borrelia burgdorferi, the agent of Lyme disease. Other pathogens are much more rare. Ticks can be tested for infection using a highly specific and sensitive qPCR procedure. Several commercial labs provide this service to individuals for a fee. The Laboratory of Medical Zoology, LMZ, a non-profit lab at the University of Massachusetts, provides a comprehensive tick report for a variety of human pathogens and makes the data available to the public. Those wishing to know the incidence of tick-borne diseases in their town or state can search the LMZ surveillance database. Symptoms of tick-borne illness. Number 1. Your symptoms. Number 2. The geographic region in which you were bitten. Number 3. Diagnostic tests, if indicated by the symptoms and the region where you were bitten. The most common symptoms of tick-related illnesses are 1. Fever chills. With all tick-borne diseases, patients can experience fever at varying degrees and time of onset. 2. Aches and pains. Tick-borne disease symptoms include headache, fatigue, and muscle aches. With Lyme disease you may also experience joint pain. The severity and time of onset of these symptoms can depend on the disease and the patient's personal tolerance level. Tick-borne diseases can result in mild symptoms treatable at home to severe infections requiring hospitalization. Although easily treated with antibiotics, these diseases can be difficult for physicians to diagnose. However, early recognition and treatment of the infection decreases the risk of serious complications. So see your doctor immediately if you have been bitten by a tick and experience any of the symptoms described here. According to the National Institute for Occupational Safety and Health, tick-borne pathogens can be passed to humans by the bite of infected ticks. Ticks can be infected with bacteria, viruses, or parasites. Some of the most common tick-borne diseases in the United States include Lyme disease, babesiosis, ehrlichiosis, Rocky Mountain spotted fever, anaplasmosis, southern tick-associated rash illness, tick-borne relapsing fever, and tularemia. Other tick-borne diseases in the United States include Colorado tick fever, Powassan encephalitis, and Q fever. Lyme disease is the most commonly reported tick-borne disease in the United States. In 2010, more than 22,500 confirmed and 7,500 probable cases of Lyme disease were reported to the Centers for Disease Control and Prevention, CDC. Outdoor workers are at risk of exposure to tick-borne diseases if they work at sites with ticks. Work sites with woods, bushes, high grass, or leaf litter are likely to have more ticks. Outdoor workers in most regions of the United States should be extra careful to protect themselves in the spring, summer, and fall when ticks are most active. Ticks may be active all year in some regions with warmer weather.